This is the Chewing the Cud podcast, a podcast for the UK dairy industry, brought to you from the southwest of England and listened to around the world. Hello and welcome to Chewing the Cud podcast, and with me today is
Sarah Bolt.
Hi Sarah, how are you going?
I'm really good, thank you.
Yeah, it's November. It's still quite mild, really, isn't it?
Very mild, yeah, for the time of year. Clocks have changed, and actually it's really nice that we've got some light mornings again. I'm sure that makes a difference to a lot of us.
Well, I don't know. I know my body clock still hasn't changed. I'm waking up even earlier. But as you say, it's mild. Cows, there are still some cows out and about. There's still a bit of maize in the fields.
Yeah, that's going to be a challenge for some, isn't it?
Yeah, definitely. I mean, it isn't, we seem to be having a little dry period. All these times they've been promising in October it's going to be dry and then within 2 days it rains. We actually seem to not be getting any rain for a couple of days as we record this.
Hopefully it will be a chance to get that maize off the ground.
Well, I hope so. It needs to happen for a few people, definitely. But anyway, enough of that. This month we're going to talk about feet and mobility. Hello, I'm Andrew Jones.
And I'm Neil Gregor.
And welcome to the Chewing the Cud podcast, a podcast for the UK dairy industry.
Farmer, advisor, processor, and everyone else. We have topics and episodes that will interest you.
We discuss the practical and the technical aspects of different UK dairy industry topics.
We aim to make you think about what you're doing and ask yourself, can it be done differently?
Listen to us speak with specialists from inside and outside the industry about their area of expertise.
Subscribe and listen to episodes for free on your favorite podcast platform, or sign up to our website www.chewingthecud.com for podcast notifications so you never miss an episode, and links to our socials.
Or email us direct on podcast@chewingthecud.com.
If you like what we do, please share and leave us a review to show your support. And that's it. Enjoy today's episode.
So hello, and as previously mentioned, we're here to talk about feet. And joining us today is Dr. James Wilson, who works as a hoof health consultant at Herd Health Consultancy. I hope I've got that right. I'm sure James will correct me if not. There's also a postdoctorate researcher up at Liverpool University. So hello, James.
Hello, it's good to be on. Good to be on with you guys today. So yeah, lots to talk about.
No, exactly. Thank you very much for joining us. Now, I met you, James, earlier this year when you did a vet talk at with the local vets. But James, before we really get into things, tell us a little bit about yourself and how you got to where you are today.
Oh gosh, well, I never thought I'd be talking about cow's feet on a podcast when I was going to school. I'll say that much. It's quite niche, but it's good fun. So my background is I'm not a vet by any way, shape or form, and I'll preface the conversations that we have today with that. I worked as a herdsman. So I worked on and off for about 2.5, 3 years as a herdsman, mostly on high input, high output herds, but also did a few organic bits and worked with some grazing herds and autumn block calving herds.
Yep.
I hated seeing cows struggling to walk. And I thought I was doing a really good job of trimming feet. I was only taught by a fellow herdsman how to trim. Yep. Hated seeing lame cows, and I decided to take a step away from herd management. I sort of wasn't lining up with the lifestyle that I wanted to have at the time. Yep. I saw a research opportunity came available at Nottingham University with John Huxley. Yep. So I thought, well, I'm really good at trimming cows' feet, so let's go and have a look at how we can help cows walk better.
Yeah.
And then did that PhD, and it turns out I was doing a really bad job of trimming cows' feet, and I'm happy to talk about that a bit later on. I don't say that with pride, but it's.
So what was your PhD in?
So we did a randomized controlled trial for 3 years where we used different treatment strategies to manage clawhorn disease in particular.
Right.
And then we put a load of dead cows' feet through an MRI scanner, which is interesting, just that you are sitting there staring at a bag of cows' feet in an MRI scanner in a hospital. And we dissected
you had to go into hospital to do it?
Yeah, and the first day I went, I took the feet in a clear box, and that wasn't sorry.
I can imagine.
Yeah, discretion's quite important in that kind of research, it turns out. But yeah, we found some really cool stuff by doing that, and we dissected a load of those as well. So I spend a lot of my time now talking about the results of the PhD that I've done, and then other research that's followed on from that as well, which has been really, really fascinating.
And as I say, I taking a step out, when we met you earlier in the year, the first thing I said to you pretty much was, "Hold on, that's John Huxley's work," and you went, "Yeah, this is a follow up from that," and so which is good, because I'd said it at the time, and funny enough, our current podcast that's out at the moment, the one on the Pedi View, I think I commented in there that I don't think John Huxley's work has been recognised enough, and that's just my personal opinion. But yeah, so sorry, so you did the PhD at Nottingham, and then where's life taken you since then?
So I moved down for a job in Cornwall, which is quite a nice place to move to. It's quite a nice place to be. So I looked after a research unit down here with an autumn block calving herd attached to it. And then my current boss, Nick Bell, just sent me a WhatsApp completely out of the blue saying, "Do you want a job?" Which I sort of pinched myself moment. He was one of my supervisors for my doctorate as well, and I know Nick really well, and I really like him. He's a great guy to work with. So yeah, it was a no-brainer to take on a job with him, and now I travel all over the country and all over the world talking about cow's feet and how we should manage them as effectively as possible.
I say you certainly travel around the world, because I know since you and I met and we tried to communicate at times, sometimes you can just be all over the place, can't you?
Yeah, I mean, so this year it's been, I had a trip to New Zealand, a trip to Venice, and I'm going to Sweden in 4 weeks, which I should probably start thinking about organising for. Yeah, so it's cool.
Where are those lame ones? Is that the?
It's we try. I think I'm trying to move away a little bit from this sort of lame, not lame focus, and actually focus on much more like positive mobility and getting good mobility in our cows. We put a lot of time and a lot of effort in, and understanding what a true cure actually is. I think we can move away from just getting a cow right and actually move towards getting her walking comfortably, whilst we're treating her as well as anything else. So yeah, it's niche. It's great fun.
Well, undoubtedly. I mean, this podcast is definitely niche. You know, I've got no qualms about that. And I know when I went to the podcast show in London back earlier in the year, it was like, what did you talk about? Well, cows. And it's like, okay. And then it was like, no, keep it niche. Do your thing. Don't be trying to be like everybody else. And that is definitely not what we're trying to do. But just thinking of New Zealand, did you catch up with John while you were down there? Or
so John organised for an invite for me to go, but it was when his MBA was... he had his graduation from his MBA, so I missed him sadly. But the time before I went out there, I stayed with John for nearly a week, and he's just lovely out there now, which is good for him. He's enjoying himself, which is lovely to see.
And thinking New Zealand, that means you probably came across, or what's his name, Neil
Chesterton.
Chesterton, that's it. Yeah.
Another of those gurus in the industry.
He's the world's nicest man, and his knowledge is just phenomenal around cows and mobility, especially in a grazing situation. He's phenomenal. I mean, actually, I've bumped into him 3 times this year now, once in New Zealand, he came over to Ireland to do a talk, and then I've seen him in Venice again recently. So yeah, sort of had a year of Neil Chesterton, but amazingly nice guy and incredibly knowledgeable in relation to mobility.
Yeah, I have met him. He did an AHDB meeting actually not too far away from me a couple of years ago, so I met him then, and as you say, a lovely guy. And as you say, it's amazing the names you know, isn't it, once you start talking to people and whatever. But anyway, enough of that. So we're here to talk about various different bits and pieces. I mean, I know one of the things when we met you want to talk about, and I think, and to correct me if it's wrong, that goes under the Herd Health Registry project. I may be wrong. Is basically getting people to get their data to AHDB to then be able to monitor trends, I'm guessing, or exactly. You tell us what's the whole aim of the project.
This project is called the UK Hoof Health Registry, and what we're trying to do is develop the genetic evaluations that we have for mobility in dairy cows. So at the moment, I'm going to probably get this wrong, but Spain, Portugal, the Polish colleagues are working on it as well. Scandinavian colleagues are way ahead on this. They have genetic evaluations specifically for mobility or breeding cows that are resilient to lameness.
Okay.
And we're quite far behind in that regard. We've got a lot of really good stuff going on in the UK, but we are quite far behind.
What are they finding then that's allowing a genetic or showing as a genetic marker for resilience to lameness? What traits is that showing through it?
So typically speaking, the frustrating thing we historically have always focused on is legs and feet.
Yeah.
This is like a parallel to that question, Andrew, so bear with me here.
Yeah, that's fine. That's fine. It is. We concentrate on legs and feet.
We've always focused on legs and feet. And whenever I've done farmer meetings on this subject for 18 months now, and whenever I say to someone, oh, what are you using to select? Like, are you using a specific trait to select for mobility? They'd say, oh, legs and feet, or locomotion would be the other one.
Yep.
And so the question I would say is, if you wanted to select for, let's say, lower cell count cows, what metric would you use, or what would you use to select for a lower cell count cow? What breeding index would you use?
Well, you're usually looking at cell count, aren't you?
Yeah, so you can make gains by looking at like udder conformation.
Yeah,
but
milking speed comes into cell count as well.
Other things come in, but the fastest gain you'll make is by selecting specifically for cell count, right?
Yeah.
So what we're doing at the moment with legs and feet is making very minimal genetic gain. Whereas actually, if we had what we call the phenotype, or what the cow actually experiences, which is lesion or lameness records, we can then use that to make much quicker gains across our dairy sector.
So it's a direct comparison rather than an indirect, I'm guessing.
Exactly. And like locomotion is how nicely the cow walks. It's not a sign of pathology or disease at all. So AHDB have launched 2 indexes. We have a DD index and a lameness advantage index. And when we've compared them to...
So DD, digital dermatitis, I'm guessing?
Yeah, digital dermatitis, yeah. And when we've looked at comparing that index to a very robust data set where we know which cows have lesions at which time points, the heritability is substantial. So it's a heritability for sole ulcers off the top of my head of about 0.3. So it's reasonably heritable. Like that would be similar to fertility, for example.
Right. So you say there's a heritability of 0.3% on sole ulcers.
Yeah, so it'd be the equivalent of 30% because it's 0.3.
Yeah. Oh, okay. Wow, that's a lot bigger than you realise, isn't it?
So if we go from a +1 cow on the lameness advantage index to a -1 cow, the risk of a sole ulcer doubles in our data set that we've looked at. So we can make like really, really good gains with genetic evaluation, but we need the tools. And I don't want to downplay how good they appear to work at the moment. That's one key message to get out there. But they could be so much better. Again, I've done farmer meetings up and down the country on this, and I always ask, is anybody actually aware if they're feeding data into this? And nobody really knows. So it appears to be quite a small data set.
Right.
And we have trimmers and farmers collecting data up and down the country. And what we're trying to do is basically gather this data, tidy it up, put it into a database, and send it off to SRUC, who do the genetic evaluations with the eGenes project, and strengthen that genetic evaluation.
Exactly. The more data you've got, the better the evaluation is going to be, the better statistically it's going to be, et cetera, et cetera.
Yeah, exactly. So with any of this data, it's like a more is more approach. I don't want to sound greedy when I say that, but more is more, with and we can cover a range of cows in a range of situations. Then if we have 5 housed units, which are all on sand, for example, 3x milking, we can tell you how well those cows are performing. But we need to get the spectrum of, grazing herds, 10 and 7 milking herds. We need to get the biggest range that we possibly can for this to be applicable to the rest of the farming sector.
So how do people, if they're not in it, how do we get people into the scheme?
So we have a series of QR codes that we're circulating at the moment and online consent forms. We are setting up integrations with Dairy Comp, Uniform Agri, and we have an integration already with All 4 Feet as well, which is a hoof trimming software.
Yeah, that's the one that hoof trimmers use, isn't it?
Yeah, so either have a chat with your hoof trimmer, or feel free to drop me a contact. My handles, I'm sure, will be tagged in this podcast, and my email's dead simple. It's j.p.wilson@live.ac.uk, and I can send a form out straight away. But we have the online link to these forms circulating quite freely out there, and I think it's important to say as well, the data will be handled with confidence. Like, it will be handled confidentially. We won't be sharing it with supermarkets or anywhere like that, and it's not like Big Brother's watching. I would like to say I have a life outside of cows' feet. I don't, but I think I would rather be in the pub rather than looking through individual records, going, "Oh, they've got this and they've got that." So it's a public good project.
You're just a nerd, James. That's the problem. We all are in our own way.
I think we all need to go to the pub a bit more.
Well, I mean, it's
only so we can talk more cows' feet or more nutrition or more about cows.
That's what we probably end up doing: get a pint and then go talking about cows again. But I know it's something I think me and Neil raised recently, and I know yourself separately as well. The joy of this is the people we talk to are all so passionate about what they talk about, and to me, it definitely comes through when we talk to them. And it just shows what joy and passion there is with cows and the knowledge behind it. And people just love it. And it doesn't matter where you are in the world, because I know we get listeners from around the world. People want to talk about cows.
Absolutely. And it's amazing. I love doing all of this kind of work, all of the policy stuff that I do. I love everything that I do. But my favorite job still to this day is either mobility scoring or hoof trimming cows. And I just love working with them. It's just, brings such joy. It really does.
Well, that's good. That's good. So ideally you want them to, let's say their foot trim is using all 4 feet, was it?
Yes.
So they just need to basically acknowledge that they're happy for data to be shared, and then it will all be signed up and onto the data.
So there's an online consent form, as I said, that's circulating. That takes 4 minutes to fill in. So we'll ask just for your milk recording ID and your herd number. Just that way we can track the cow heritages, so we know actually which cow is which. If you go through all 4 feet, there's a little integrations tab that you can click on your dashboard. It's amazing how many people don't realize they have a dashboard where they can get all of their reports and they can put it into Uniform and Dairy Comp if they want to. It's a really good tool. But there's a little integrations button where they can link up with us directly through their All 4 Feet app. From my experience, that's been the easiest way for farmers to share data with us. And if they're using a trimmer who uses All 4 Feet, that's the easiest way to do it by and large.
Okay, well, that's good, because really, as you say, the more data you've got and the easier it is for you to get that data, the better it's going to be, and to the benefit of everybody in the industry, isn't it?
Absolutely. We've got about 400 farms now signed up, and some of them are big herds and some of them not so big herds.
It doesn't matter, does it? It's still cows. You've got cows.
And but that is a decent data set, but we just need to keep adding to it, because the more we keep adding, and year on year, we'll keep gathering data to carry on, the stronger that this tool will become for us as well. So, that's been my mission over the last year so far, and we're going to carry on with that going forwards as well.
It's good, because I know you've had a few farmer meetings, haven't you? Unfortunately, I haven't been able to make a couple that have been locally, just have clashed with other bits and pieces myself, or I definitely would have come along. But other than that, I know you said there's a few things you like to talk about with feet at the moment, and well, so there you go. I guess if that's what gets you off, James.
Sorry, some people go to pubs that, don't they? So.
But the other one you mentioned was the Healthy Feet program. Do you want to? Well, maybe Sarah, you said you were part of the.
It was all started when I was at AHDB, and I'm going to say it's probably 10, 12 years ago that the Healthy Feet project was launched. I don't know if you know, James, but
it'd be a bit longer than that.
Is it even longer? See, I'm having fun.
So Nick Bell, who's my now employer, part of his research has been establishing sort of methods to encourage farmers to manage hoof health on farm, and we've sort of been adopting this technique of motivational interviewing, which feels like it's a bit of a buzz phrase at the moment across the industry, but we are trying to step away from telling people what to do, because it is quite patronizing. Most of our farmers know what they should be doing and what the right thing to do is, but it's actually understanding what are they happy to do or not happy to do, and what are their motivators behind it. So with the Healthy Feet program, it's very much facilitated, and that's sort of what a bit of Nick's work to start with established, is that this facility.
I was going to say, it takes me back even to my MilkLink days. I remember now that working with Nick and the Tubney Trust with that original project. You see, I am going back even further now.
Back in the day, isn't it?
Yeah. I didn't realise how close I've been to this.
You're going to start sounding old at this, right?
I know. 29 again.
So the mobility mentor the Mobility Mentor program is a really useful tool that I think is a bit underutilized on farm, to be honest. It's a shame that it's not being utilized as thoroughly as it could. There are some farms that get really good results for it, and we have some lovely case studies around this. But it'd just be nice to see a bit more uptake on farm, and vets, consultants, hoof trimmers can be mobility mentors who are trained to deliver this program.
So how do you do that?
How do you
mobility mentor?
So at the moment, you either need to be a vet who's 12 months graduated, or have done the level 4 qualification in hoof trimming offered by the Royal Agricultural University. Or, this is off the top of my head, I think the MPTC level 3 means you can also, which is a hoof trimming qualification, you can also deliver the Healthy Feet program. You also need to be what's called ROMS accredited, which is the Register of Mobility Scorers. So you need to be like an accredited mobility scorer to deliver it as well. And there's 2 branches to it. There's the Healthy Feet program and the Healthy Feet Light. It gets a bit confusing for me. I don't know, it's pretty straightforward. But both of them start with like a baseline, and I think the baseline is quite important, where we just get an independent mobility score to see where the farm is to start with. And it's not judgmental at all. You know, I've had farms that I've been working with high prevalences of lameness where I'm not there to judge them, I'm there to help them. So that baseline of where we're starting is really important.
What do you think the average is, James? Because it's always quoted as about a third of the cows are lame at any one time. Now, I know I have asked you this question separately a couple of months ago, but I mean, that figure's quoted on the website. I'm going to be honest with you, like the hoof count and on herd vision and all these things. And yet, but Neil and I have spoken about it, and we both mobility score, and neither of us see that amount of lameness on farms ourselves when we mobility score. Now, so where do you genuinely think the score is now? Is that historical and it's still quoted and needs to be updated, or do you think that is really where it is, and maybe we're just lucky with who we see, or
the first thing I'll say is hopefully watch this space. We're trying to get together a prevalence study where we visit a random sample of UK herds with their consent. Obviously, we're not just going to pick So watch this space. I would like something to happen, because the data that we have on that is 10 years old now. Both of those prevalence studies are old.
Right, because ultimately, if you're looking at it from the consumer, saying that you've got a third of your cows at any one time are lame doesn't
sound too good, does
it? No, it's not for the industry. If we could, at least if you say, if this is updated, we can show that in the last 10 years we've gone from a third to whatever the score is, then that shows we've done a good thing.
It's interesting, because I ran a focus group a few weeks ago, and people have said, if we quote 1 in 3 cows or 33% of cows being lame, if a client of ours has a 20% prevalence, they may not be happy with it, but they're thinking, well, I'm doing better than the average, and is that okay? But the bigger core of that conversation, I think, is that mobility scoring has strayed a little bit away from what it was originally designed for. It wasn't really designed as a benchmarking tool, and these prevalence studies are useful. They have their place. And benchmarking across milk buying groups, for example, and stuff like that absolutely has its place. But the mobility score was there to identify cows that would benefit from inspection.
Yes.
And the farms that are really getting great success with mobility are mobility scoring with that aim in mind. They're mobility scoring their cows frequently, identifying cows with early or subtle challenges to mobility, getting them in the chute and checking their feet. If they need to get them in the chute, they might not need to necessarily.
Yeah, I suppose when I mobility score, I'd like to hope that's what I do sometimes. Sometimes a cow's walking fine and you go, well, she's a 1, but something's just niggling at me. So I know I'll put a little asterisk next to it and go, look, she's not a 2 that she needs picking up today. But actually, I think you should just have a look at her, because there's something in my head says something's just not quite right, and I don't think she's lame today, but it's just not. Yeah, so to me, that's my mindset, is very much, as you say, is hopefully, okay, she's not there for the score that you're looking for, maybe for your milk contract, but just have a look at her, because something's just doesn't seem quite right to me.
Yeah, and we're having a lot of conversations within the Register of Mobility Scorers in the moment about the approaches we take to those kinds of cows. Someone said the inconsistently inconsistent cows. Sometimes I think if cows had a middle claw, they'd stick it up at us because they do like to make life difficult.
Well, I've got to be honest. I know with one farm I go particularly, very open with the conversation, and it's like, well, have I got who I thought you have I given you a list of who you thought I was going to give you? And you went, no. But it is, as I say, I only see those cows for those few moments as they walk past me, and in that particular moment, she's walking fine.
Yeah.
But then again, I'll pick up cows that they're not picking up as well. So it is a bit of swings and roundabouts, but very much so, like you're saying, some will go, oh, no, I'm not being prey to that strange man that stood there with a clipboard, so I'm going to walk fine as I walk past. Well, it is. You're just there for a snapshot of the moment in time, aren't you?
Yeah, absolutely. And we can be sensitive with it, and we can pick up very early stages of pathology. That's the aim of the mobility score. But there are challenges to it. I think we're all open to there being challenges. But to answer the question, I would like to think that our prevalence of lame cows, if I call them that in inverted commas, I'm trying to move away from the L word, but our prevalence of lameness in the UK, I would like to think has dropped. I do score quite a lot up and down the country.
Yeah.
But I do see there still being extremes at both ends. I mean, I had my first 0% mobility score ever the other day.
Wow,
that was cool.
Awesome.
Yeah, that was nice. So, but in the same week, I had a herd that are facing quite a lot of challenge. And again, like, my mission is not to be there to be judgmental and say, "Oh my goodness, look at how many lame cows there are," but it's to say, right, this is the situation. Let's get out of it. And that's where the Healthy Feet program, to come back to that, is very good at setting the scene for that.
Sorry,
I was just going to ask about the sort of the Healthy Feet project, and then sort of how it then would work with a herd like that one that you've just suggested. Sort of, can you talk us through a little bit about how that would work?
Yeah, sure. So, there's a couple of different streams we go down with it. So there's the Healthy Feet Light, and then there's the full Healthy Feet program. I'll talk through the full Healthy Feet program because it's easier to cover everything that we do there. So that starts off with a ROMS accredited independent mobility scorer going to the farm and scoring the cows. That can be the same person who's your mobility mentor, or it could be a vet tech or an independent mobility scorer working locally. That data is then given to the mobility mentor. They'll also have a look at maybe some of the lesion records and look at what data capture is going on farm to see if there's any sort of standout cause or challenge to mobility, I should say. So let's say that'll set the scene for if you're seeing a lot of white line disease or a lot of sole ulcers or a lot of digital dermatitis, for example. It just gives you a bit of brain food to think, okay, this is the kind of thing I need to be thinking about when I visit. There's then also a skills check sessions. That's when the mobility mentor will go on farm whilst some cows are being mobility scored, if the farm staff are doing that in-house, and also trimmed if they have a contracted trimmer or whoever. And there'll be just a bit of a crush side session. How are we recording stuff? What's the trimming protocols? What are the treatment protocols? And it's not a prescriptive, you need to do this, you need to do that. It's much more of a coaching kind of approach. That's the approach I tend to take with it anyway, sort of asking quite hopefully provocative questions. Why would you put a block on this and not this? Why would you bandage this and not this? The stuff like that just opens up the conversation. There's a farm walk and a risk assessment with the farm walk, but the key part of it is this action plan at the end. So we sort of break it down into 4 quadrants. So we'll focus on early detection, prompt effective treatment, a low infection pressure, a robust foot, and reducing forces on the feet. And each of those is related to an individual lesion type. So if I'm looking at sole ulcers, for example, I'd focus on forces on the feet and early detection and prompt effective treatment. Because if we're seeing sole ulcers, we can pick them up earlier. We can pick them way earlier when they're a bruise, which is lovely. Yeah. And so, those quadrants are filled in by the farm. How can they reduce the pressures in these areas? And we deliver this action plan and try and set out some timescales to it. And then we review and check and monitor and make sure everybody's getting on okay with what they're meant to be. And the mobility mentor's there to help all of that process take place, but also provide support afterwards if needed. And that's the bit that I love in particular, is once we've done the action plan, seeing how far people take it. I remember my first Healthy Feet program, I thought, oh my goodness, have I done the right thing here? Because they had a sole ulcer challenge and they wanted to focus on DD. and they bought new scrapers. They did some training with the staff on how to clean yards out more thoroughly. They invested in a couple of tip-over troughs to help wash out yards and stuff like that. They changed their foot bath protocol as well. And I was thinking, gosh, this isn't going to help with the sole ulcers. But they ticked off the first 3 or 4 things off of that list and then thought, oh, hold on, let's go on to the next thing now and carry on. And then they took out some ridge tiles, which improved ventilation. They improved cubicle comfort. And yeah, it's amazing how people will roll with these things, really.
But I mean, to me, do you see a lot of sole ulcers still?
Very variable. Yeah, I do. No, it varies a lot. When I'm trimming, I don't tend to as much because the herds that I trim with, I try and encourage to implement early detection and prompt effective treatment. Okay. But it feels like there's, again, this sort of split that's occurring where maybe those middle herds are improving mobility overall, but there are some herds that are struggling to get on top of their mobility, and those are the guys we'd see sole ulcers in. Yeah, I would still see sole ulcers.
Because if I take a step back, I would argue from what I saw of John Huxley's work, sole ulcers usually comes down to a bit of a nutritional problem. Would you agree with that?
There are challenges in line with nutrition. This is a really, really interesting balance. So when we look at the risk of clawhorn disease, we can attribute 80% of that risk to previous clawhorn disease.
Right.
So it's a self-perpetuating cycle.
Yeah.
Which is really, really interesting. But in terms of nutritional management, body condition score is the main link that I've seen. Biotin is the other one in terms of managing white line disease. I see body condition score personally being a bigger risk in the grazing herds that I work with. The housed herds, or also more all-year-round calving herds, do tend to be slightly better at keeping a more consistent body condition score, I would say.
Because that was the outcome of John's work. Well, John's work wasn't it? The thin, let me get it right. The thin cows go lame or lame cows go thin. And basically he showed, wasn't it, any cow under 2.25 on any given day is more likely to go lame. And if she drops too quickly post-calving, I can't remember what the scale was now, but that was also more likely to go lame. And in both instances, more likely to show sole ulcers, wasn't it? Because they lose the fat pad in the foot.
Yes. Well, the interesting bit as well is that it appears to be not necessarily a thin fat pad that is a challenge, but a thinning fat pad is a bigger challenge. Yeah. And what some of the work that I've done, and I've seen a few other colleagues have published a couple of other papers in this area, and we're in the process of doing some work on this at Liverpool at the moment, is actually also managing the period around transition appears to be really, really important, especially in relation to inflammation. So if you bump your arm, it becomes red, hot, swollen, increased blood flow to it, for example. That's what we would describe as an inflammatory process. And we see that happening across the cow. And so it's interesting to think, is there going to be a way nutritionally that we can manage that inflammatory response? We used non-steroidal anti-inflammatory drugs to try and mitigate and manage that response with with very good response rates in relation to lameness and culling as a result of that. So I think there's a lot more work to be done on the impacts that nutrition could have in relation to managing lameness. Absolutely.
And you mentioned biotin. Do you feel... should that be 365 days a year? Or some people might say, well, actually, I'm not going to feed my far-off dries and minerals. They won't be fed for 3-4 weeks or whatever it happens to be. Where do you stand on biotin?
Great. It's so hard to get it into them in that period,
exactly,
isn't it?
In that period, exactly. Hence, I guess the question why some people just don't. It might be in there, the transition. It might be in the mineral all the way through milking. But if there's a period that gets missed, it's those 3-4 weeks potentially in the far-off dries. So, I mean, biotin should be in there.
Absolutely. So the challenge we have with biotin is if we drop it out of the ration, there is a lag period between us including it in the ration again and that actually supporting good quality horn growth. So my argument would be always try to include it in every single 365 days a year where possible. You can get boluses. I haven't had that much experience with boluses. I don't know if you have, Andrew, at all, but you can get biotin boluses.
I wasn't aware you could get biotin boluses, to be honest.
So there's a couple of grazing farms that I've sort of visited, not done much work with, but visited who've been using some biotin boluses, and they think they get on pretty well with them.
I mean, what about other minerals, I guess, as well? Because usually zinc's always another one that's usually talked about for hoof health as well, isn't it?
Yeah, so it's interesting. Again, we don't have masses of evidence in relation to trace mineral. I know that there's companies that do a lot of work in this regard as promoting mineral supplements. There's some work. It's not massive, and I think if anybody's looking for something which is really I say really easy. It's not the easiest process to engage with, but if they're looking for something, they can start day one today.
Yep.
Rather than investing in, I'd say biotin is pretty much mission critical.
Yep.
But other than that, I would say the biggest investment would be in mobility scoring and picking up more cows and treating more cows.
Yeah.
In terms of return on investment.
Quick response, basically, into say early detection, early treatment. But because what is biotin? It's about 3 or 4 week lag, isn't it, between start when you see it?
I think it's more than that. I can dig out the number to be exact, but from memory, it might even be 60 to 70 days.
Well, either way, it's still a long time.
Yes, yeah, it is, absolutely. And so, and when we want that biotin in the ration, when we want that biotin taking effect in the cow's foot is in sort of, especially the 60 to 80 days after she's calved, when her foot's like a primordial soup anyway. So I think keeping it in that far off dry and close up dry ration, or whatever you're feeding them, is useful and important. Especially in a grazing situation where there's a bigger risk of white line disease. And the other approach we could take is if it's just like a non-negotiable, we can't put anything into our far off dries and our close up dries, for example. Would be okay. Well, let's look at the other pinch points, for example. And this is the kind of approach we take with the Healthy Feet program. How else can we reduce the shearing forces on the feet? Improve foot shape, for example. How can we improve your trackways so your cows aren't going to be slipping or skidding on them at all? That's the kind of thing I'd think about.
Yeah, or can be the flip side. I've seen it in places before. They've roughened up the concrete to improve the grip, but they've made it too rough.
Yeah, it's interesting. So, are we trying to hide a multitude of sins sometimes with some of our interventions? So by feeding biotin, are we trying to cover up poorer trackways, for example, or by routine hoof trimming? And routine hoof trimming is really important. I don't want to downplay it, as is biotin. But are we looking to hide another challenge that the cows are facing with routine trimming, for example?
As you say that, how often would you say routine? Because I was local discussion club I'm secretary for. They had a local foot trimmer in to come and talk earlier this year. Steve Paul, might as well say. So hi, Steve, if you're listening. Was he said, is it the Danish do effectively a service every 4,000 litres, did you say, or something like that? I think it was. So they make sure they trim the feet every 4,000 litres, rather than like here most people are pre-calving and whatever. Yeah. So what would your take on that be?
So it depends on the cow and it depends on the system, which feels like a real get out of jail clause. So our Danish colleagues from memory have a government managed system. I think it's the Clawcoin system, where some trims are paid for by government and in exchange for certain standards of data management and bits like that. So for grazing cows, for example, let's say we're looking. Let's go from one extreme to the other and sort of stop midway through on the way. For a grazing herd, personally
spring calvers doing
spring block calving,
5,500, 6,000 litres, maybe
5,500, 6,000. Would their biggest return on investment be in routine trimming every cow twice a lactation? My argument would probably be not. Would the bigger return on investment for those guys be on really mobility scoring those cows sensitively, picking them up and throwing a gold standard treatment at them? Yeah, probably a much better return on investment for those guys, just purely based on like a practicality basis. If you're going to put 500 cows through a foot trimming crush, especially in a block calving system, on a days and milk perspective, that becomes a huge amount of disruption and work for the team. Yep. Whereas mobility scoring fortnightly can go into the routine a little bit and become normal. And where's the benefit in terms of spotting an extra, preventing 10 lesions or 20 lesions, where's the return on investment in terms of routine trimming in that herd for that number of cows and that level of disruption? Let's go to the other extreme now and go to 12,000 litre robots or 3x milking herd, whatever. Let's say management overall is generally pretty good. I would argue 3 times the lactation could be a good trimming intervention for those guys. But it depends on if clawhorn disease is their challenge, because I can't trim my way out of a DD challenge, for example.
Yeah.
And so it becomes a very holistic picture. I think I get nervous with the concept of if you just foot bath and routine trim, we can solve all the problems that we face. I'm not saying that anybody's advocating that, but I think that syndrome can be slipped into, and it's taking a big picture. So I've got herds that I've worked with where they're trimming 3 times a year. Each cow gets a trim 3 times a year, and their foot bath is working pretty well. They've got hoof counts. They work really well. They're good foot baths. But they had a heat stress problem. So their cows were standing up and panting excessively, and they were still seeing bruising and ulcers. They had a great trimmer, really lovely trimmer, great conscientious worker, but the cows were heat stressed, so they were just standing up all the time, so they're still seeing bruising and a few ulcers as a result of that. And so it's the whole farm picture, I think,
looking at the big picture.
Absolutely. For those guys in the middle, maybe twice a lactation could be a good option for them, again, if clawhorn disease is one of their bigger challenges. But again, I look at data, and I feel like a boffin here and a bit of a nerd, and again I need to go to the pub, but
you are Dr. James Wilson.
There's I won't swear, but I could throw the proverbial at the wall in the hope that some of it's going to stick. In relation to hoof trimming, I could go stick my finger in the air and go, I'm going to trim at 120 days in milk and 200 days in milk, and that'll do me fine. In reality, we might be finding sole ulcers at 120 days in milk on our routine trim, which means that we're not picking up those girls early enough. Whereas if I look through the data and see, oh, well, hold on, I'm seeing a little spike in sole ulcers at 100 days in milk, let's move our trim 40 days before that, for example. It just means we can be really strategic with these tools.
And does that really pick up on, both of you have mentioned sort of that early detection, that's something that is so important, and again goes back to some of the earlier John Huxley work looking at that early detection,
absolutely,
really making that the priority.
Yeah, I mean, I as I said, I don't want to put routine trimming absolutely has a role to play, but it appears that the bigger, from the data that I've seen, the bigger return on investment is in catching cows as early as you can in their disease challenge, because we actually don't have masses of data showing positive effects or substantial positive effects from routine hoof trimming. What we do see real benefits from is picking up cows as early as possible, and if they have a clawhorn lesion like a sole bruise or maybe the startings of a bit of a mild white line separation, we apply a therapeutic trim, which is sympathetic to the foot, an orthopedic block, and we give them ketoprofen for 3 days, typically. So that's what we have evidence for, and that all 3 of those are vital to getting, sort of throwback to what I was talking about earlier, not just a cure, because we can cure a cow, we do that through different ways, but actually returning her to good mobility, which is the most important part, I would say.
And that message has been around for some time. However, is it actually happening on farm? Are we seeing the use of enough blocks and enough non-steroidals?
I think it's getting better. I think, to be fair, pharmaceutical companies are doing a good job of promoting their product in the right way as well. It's not just, they're not taking the hard sell type approach. Blocks are something which I do see being underutilized, especially in relation to early stage disease, the bruising kind of thing that I'm talking about. And that might be where you can't see something, but if you put a set of hoof testers onto that cow's foot 3 times and you get a withdrawal each time, you think, okay, let's treat this as quickly as we can and effectively as we can. That's the kind of cow that I want to throw everything I possibly can at, because those are the girls where we see the real return on investment.
Because the earlier you sort it and the better you sort it, the less problems it's going to be, isn't it?
Yeah, exactly. And what we see with these sort of more chronic girls, like sole ulcer cows, for example, is they'll grow bone inside the hoof capsule. So the little triangular bone that's held inside that hoof capsule will grow on the heel quite substantially, and they'll
some spurs effectively.
Yeah, it can become so severe that the joints will fuse. P2 and P3 can fuse in some cows.
Right.
It's pretty substantial. And we'll see the fat pad scarring and being metabolized as well alongside it. So when we think about that kind of animal, that's an emergency. We need to jump on them and really throw everything we can to stop them going on this downward spiral, because that bone growth and that change to soft tissue, all that's going to do is predispose her. And so using a block, a trim, and anti-inflammatory, we think from the data that we have will mitigate the risk of that animal continuing down that pathway.
Certainly 3 or 4 years ago at Kingshay, we did a tried and tested report on hoof blocks, sort of asking farmers, foot trimmers, vets about how they went about that process, and it was still surprising as to how many still didn't use that non-steroidal.
Yeah,
and
absolutely.
Hopefully it has improved in those last 3 or 4 years.
You mentioned hoof count, and as we record this, that's now our current podcast. What are your views, I guess, on technology and where it's taking us? Because I mean, hoof count at the moment is obviously, with the PediView, is looking at the detection of DD, but also I know I've been told Nick is already thinking of things way in the future with it. So mobility scoring is potential with that. But I mean, at the same time we recorded that, we also sat down, it hasn't been released as we record this, with Herd Vision. And I initially thought it was just a condition score, but they also mobility score. Where are your thoughts, or where do you see technology going for mobility scoring?
Yeah, I mean, I think, again, great question. I think it's the future and it's coming. And within ROMs,
I think that PediView is a game changer.
It really is. It really is phenomenal. And again, for somebody who needs to go to the pub a bit more often, to be able to sit before I do a visit to a farm and just quickly scroll through every single cow's foot on a computer screen. I don't have to lift an entire herd's worth of cows' feet now to have a look at what the underside of them looks like. What's the trimming protocol like? All that kind of stuff. It's really cool. And the algorithm they're training to spot DD looks really positive as well. I remember when Nick showed me the videos the first time around, I was just absolutely amazed at what they were able to capture. And there's been a lot of work go into that.
When you actually see it, I remember the first time I saw it, it just blows your mind.
Yeah, it is. It's a real feat of ambition, I think, to get something like that over the fence. It's amazing what video quality they've got as well.
Definitely. I mean, I know as we record this, it's just past the dairy show up at Shepton.
Yep.
And I ran into someone I know, farmer, not a client, but he happens to be a member of the discussion club I'm talking about now. The discussion club went up this summer and had a look around and was shown it, some of the older members. And they're like, the younger ones need to come and see this. And I know I was talking to him, and he was sort of saying he's an active farmer. And as he said, while myself and my brother have the skills of a lifetime on farm, he said, as we're getting bigger and not the same set of skills within the staff we've got, having this kind of technology allows that to pick up some of the things that you or I might walk into a calf shed, was the example he used, and say that calf's wrong, but with a robotic feeder, it'll tell him straight away that one's not sucked, it's not done this, it's not done that. It's not a replacement for labour, but it just helps tick off some of the boxes. Yes, it's all a tool, but it just helps fill in some of the gaps, especially as we're all getting busier and bigger. It just sort of helps, doesn't it?
Yeah, I think that the caution, and this is for farm advisors, for farmers, for vets, for anyone, even myself. It's very. And Hoof Count have done a lot. They've invested a lot in terms of developing the product of PediView, which is great. I think the thing I say about technology overall, and this is a big generalization, and it's the same for anything really. If somebody says to me, look at this drug or this treatment, it's going to cure DD, it's going to treat all of your clawhorn disease, your cows are going to walk perfectly, I always just ask a very fundamental question: what data have you got? And if they say, oh, Bob Jones up the road is using it and he swears by it, that's not data, that's not evidence for me. And so again, being a scientist, feels weird calling myself that, just a hoof enthusiast / scientist. That sounds better. I always encourage people just to ask a couple of fundamental questions around what actual evidence have you got? So for the mobility scoring, for example, do you have comparisons to human mobility scorers to start with, which isn't perfect? I'm not going to say that that's perfect at all, but do you have comparison to human mobility scorers? And how good is your tool at finding lesions? That's the other question I would ask.
You did. You reminded me. I still my father's story saying about his father being told just after the Second World War, this will cure mastitis. Obviously, the first antibiotics. This will cure mastitis. Mastitis will never be a thing again. And here we are now. What's it now? 80 odd years later, 90 years later, whatever it happens to be. Yeah. And it's like, yep, it's still going, and it's still going strong.
Yeah, and I think the other important thing is to think about actually all of these. This technology is actually making more and more data on farm, and actually finding the time to look at that data at a sensible, timely.
I remember being told that we put the rotor in North Queensland, and we were looking at adding some milk meters and whatever on it, and they're like, "Well, that's great, but you've got to," and that was then, and we've moved on a hell of a lot since then. You've got to have the time to look at that data. There's no point doing it if you haven't got the time to use that data to then make decisions from that data.
And you start talking about sort of skills on farm and stockmanship skills and seeing these things, but actually now it's then a case of the staff need to be able to understand the data that's coming out of this technology, isn't it?
This feathers really nicely into another point I was quite hoping to make, so it's perfect. It sounds like you guys read my mind. We don't have a script either, which is good.
Don't believe in one of them with these.
So having a lameness, I hate calling them this, a mobility champion, that's much better. Mobility champion on farm is really useful in relation to this. So having somebody who's automatically, their job is to make sure the foot bath's working, that cow's getting routine checks in good time, the mobility scoring's happening, this, that, the other. Having like one person whose job that is actually means that they might get a little bit of time to look at some of that data and some of the stuff that's coming off of these different platforms that we have, but actually also just make sure that some of those jobs get done. Again, the farms that I work with where we get the best success, they have somebody mobility scoring cows and treating cows, and they're also the one who's keeping an eye on the foot bath. You're making sure that if there's other cows that need to be presented to the vet for mobility challenge, that happens. They cover all of the mobility bases, and they get really, really good results.
Their job, their specialty, whatever it happens to be, rather than being the one that feeds, is all the mobility, I'm going to say issues, all the mobility maintenance, whatever it happens to be, is done by that one person.
And I really like that idea.
Yeah, and that gives, especially the ones that I really like working with, is when they give it to somebody quite young, maybe with some oversight and some tutoring and mentoring and stuff like that. But that young person sees that as something they can take ownership of on farm, and they really like it. From my experience, anyway. Obviously, if it's somebody who just wants to sit in tractors and pull grass around, then that's maybe not something they're going to enjoy. But
perhaps that's how we grow enthusiasm and passion for feed, isn't it? It's
we need more hoof nerds.
I think the next time James comes up this way, we need to take him out the bloody pub, is all I've got to say. Oh dear, but I'm just sort of looking at the time a little bit, and is there anything else you really want to talk about, James, before we sort of wrap this up?
I think the only other thing is just to really drum it. I've sort of brushed over EdPet a little bit and sort of talked briefly about it. And I think it's useful just to really talk about what it means. And so let's sort of break it down to early detection, which is sensitive mobility scoring. And the mindset you need to go into with it is, would this cow benefit from an inspection? If she is, I'm going to bring her in for an inspection. Yep. And then the prompt effective treatment happens 48 hours after you've spotted any cows you think that would benefit from a check. And typically speaking, it's a trim, a block, and 3 days of ketoprofen for girls with clawhorn disease, so like bruising, ulcers, white line, anything like that. Just double check underneath the other claw that it's okay with hoof testers if you're going to put a block on as well. That's a good tip. That saved my backside quite a few times. and recheck those cows as well, because again, when I was working as a contracted trimmer whilst I was doing my doctorate, we'd sort of let cows out of the crush with a block, and they'd sometimes just go into the ether, and we'd never see them again until 4 or 5 months later. They come in with a block on, and we've not seen that cow, even though we've asked for that cow several times. So rechecks on those girls are really, really important. For DD, I apply. So I work with a vet and apply whatever treatment the vet is happy with me applying, but I need to make sure the lesion is clean, and I'll open up between the claws to make sure that lesion's clean as well. I personally don't bandage for DD. I just see a lot of damage caused by bandages. If I'm going to, I use like a dissolvable one. There's some really good dissolvable ones out there.
Yep.
And then I think the caution note I add is that we have really good evidence for treatments working quite well in heifers. And so if you're going to start protocols, every cow that needs an inspection and needs a treatment, but you'll see your biggest and quickest gains from your heifers going forward. So mobility management is a long game, is what I'm trying to say. It takes 2 or 3 years from having quite a high prevalence to see that come down, unless you start culling, which is always a bit of a solution, but it feels that can be a sticking plaster type approach. The best approach is to manage these girls out of the herd over time if we can get them comfortable.
Yeah, definitely. As you say, it's, don't put them back in calf again, but keep them going until the end of the lactation rather than in the moment sort of thing. Yeah,
exactly. Because again, that can just cover over a load of stuff. You can cull your way out of a lameness challenge by just culling lame cows, but actually, if you don't look at concrete grooving, if you don't look at cubicle comfort, hoof trimming protocols, all that kind of stuff, you're just, you're peeing in the wind.
Yeah. Sarah, any thoughts?
Lots.
I'm sure there are.
But I think it's just that the early detection, as I say, we've been talking about it for a long time, but it's actually making sure it happens.
Yes.
And that links into that mobility scoring and then actually doing that prompt effective treatment, isn't it?
Well, and
if every farm could do that.
It's having that team around you to be able to do that, whether it's the foot trimmer, whether it's the vet, whether it's the nutritionist, whether it's bringing in someone like yourself or Nick, or whether it's having the right equipment in terms of a foot bathing, right chemical. That could be a whole nother different subject. It's just bringing it all together, isn't it?
Yeah, absolutely. And I've seen herds that implement really good routine trimming protocols, that really good in inverted commas, where they'll be trimming cows 3 times a lactation and they'll still have score 3 cows.
Right.
It's sort of quite severely lame cows. Whereas there are other herds that I've worked with where they fortnightly mobility score, they regularly check cows' feet. And don't get me wrong, if a cow's looking overgrown, they'll bring her in and they'll still have some routine checks, but they won't have score 3 cows because they're just so on it, picking up any early challenge that they can find. So yeah. They get good gains from it, really, really good gains.
Okay. Well, I know, as you say, we've sort of skimmed over everything to give everybody a bit of a flavour of what's out there. But I guess really, if you are trimming or your foot trimmer does, please, from James's point of view or from all of our points of view, try and get yourself registered to go on the Herd Health Registry so that we can have that data to improve these genetic gains, hopefully a thing. But I'm still blown away that it's a 30% inheritability on the sole ulcers. That's massive.
You'd take that for anything else, wouldn't you?
Yeah, definitely. And then obviously we spoke briefly about the Healthy Feet program and then EdPet. So we've covered a lot of ground today, but that's great. That's what we wanted to do. And just hopefully, like always, make people think, and can they do something differently that will improve what they're doing on farm?
Absolutely. I think the question I'll leave people with, if it's okay for me to do this, is to say, how or what could you do today to improve mobility on farm? What could you do right now? And that's
exactly.
Question.
It is, and the first answer I'd probably say is get someone to mobility score, because if you don't know what your baseline is, then you don't know where you do or don't need to go, really, isn't it?
Exactly.
Good. Right. Well, I think otherwise, in that case, I think it's a goodbye from me.
It's goodbye from me, and thank you.
Thank you for having me on. It's been a real pleasure.
Thank you very much, James. Thank you for listening to the Chewing the Cud podcast, a podcast of the UK dairy industry brought to you from the southwest of England and listened to around the world. And now for the really boring bit, I'm afraid, the legal disclaimer. The information provided during this podcast has been prepared for general information purposes only and does not constitute advice. The information must not be relied upon for any purpose and no representation or warranty is given to its accuracy, completeness or otherwise. Any reference to other organisations, businesses or products during this podcast are not endorsements or recommendations of Chewing the Cud Limited. The views of Andrew Jones are personal and may not be the views of Chewing the Cud Limited, and the views of Sarah Bolt are personal and may not be the views of Kingsafe Farming and Conservation Limited and any affiliated companies. For more information on the podcast and details of services offered by Chewing the Cud Limited, visit www.chewingthecud.com. Thank you and goodbye.